Hello. Good evening, everyone. இது இருக்கும் உலகத்தை நகர்த்தும் மற்றும் மனித குலத்தை ஒன்றாக் அணைக்கும் நற்பண்புகளில் ஒன்று கருணை. Compassion. It is compassion, the most gracious of the virtues that moves the world and binds humanity together. I am Hina Jain and I welcome you all to the Parivarthan's annual memorial lecture. I am part of Parivarthan's team from past 1 year and I'm be working as a dance movement facilitator, helping the members heal using movement to support healing and self-expression. I extend my heartfelt welcome to our speakers of the day, Dr. Sudhir Ayyappan. I welcome you, sir. And Miss Saraswati Vasudevan, ma'am. Welcome, ma'am. And our beloved members, their caretakers, our extended Parivarthan family, and volunteers from Stella Maris College. I welcome you all. T.R.L. Narasimhan Annual Memorial Lecture is an event dedicated to learning, sharing, and advancing our understanding of Parkinson's disease and the many ways we can support those living with it. Today, we come together to explore new and holistic ways of enhancing the well being of individuals living with Parkinson's. This year, we are excited to introduce new insights into the benefits of Ayurveda and yoga, two powerful Indian traditions that have been gaining recognition for their role in managing PD symptoms, improving mobility, and fostering overall well being. Through today's presentations, we hope to provide valuable knowledge and practical tools that can empower individuals, caregivers, and families in their journey with Parkinson's. This event is also an opportunity to express our heartfelt gratitude to all those who make this mission possible, the dedicated healthcare professionals, therapists, caregivers, and most importantly, the individuals living with Parkinson's whose resilience and determination inspire us every day. We look forward to an engaging and enriching session where we can learn, share, and grow together. Thank you for being here and being part of this wonderful community. Let's make today a meaningful and memorable experience. I once again welcome you all to T.R.L. Narasimhan Annual Memorial Lecture. I call upon Ms. Dhanalakshmi to introduce our member.
Hello, ladies and gentlemen. Good evening. I am Dhanalakshmi, Program Manager of Parivarthan for Parkinsons Foundation. I have been in Parivarthan for more than 3 years. I am coordinating and managing online and in-person sessions of our supportive care programs, including physiotherapy, yoga therapy, dance movement therapy, speech therapy, Varma oil massage, counseling, and art and craft sessions. It's my pleasure to introduce our one of our active and enthusiastic members, 81 years young man, Mr. Janardhan. He is so calm and kind. He is very regular to our all our programs. He was very dedicated and sincere to his work. So I am warmly welcoming him on stage to tell you a few words about him and share his experiences with the Parkinsons and Parivarthan. Please welcome, sir.
It's okay. Thank you. Thank you very much, Dana, for introducing me. I see many familiar faces who are all from Parivarthan family. My name is Janardhan, and I am in Chennai for the last 3 to 4 years. Before that, I was in Mumbai for almost 60 years. What made me shift to Chennai after 60 years is what I'm going to tell you. About a decade ago, we had a lot of friendly diseases like dengue, chikungunya, etc. So I was also caught in that dengue fever, and I went to the doctor one evening, and he gave me medicines and all, but I drove to the hospital, to the doctor. But when I want to get back to the car, I could not lift my leg. It was so difficult. I could only move by inches. My wife was sitting in the car, and somehow I got into the car. And once I'm in the car, I had no problem driving home. But again at home, it was very difficult for me to reach home. The next day morning, somehow, I could go to the doctor. I went to Bethany Hospital, and he told me it is dengue. You have to get admitted. So I got admitted in the hospital for about a week, and I was all right, but I was weak, and I could not walk properly. Then I came alone. Then I was losing my balance, and after I came home, they told me my platelets had gone down very low, so I should be careful, and somehow I managed. Then after a few days, again, I was not feeling well. So then I called my daughter from Chennai to come, and my wife and she together took me to the hospital, that is in Jupiter Hospital in Thane, which is one of the very big hospital in Chennai, in Thane. And there they kept me waiting for about 4 or 5 hours, and they did the testing, and they told me it is, they inserted that thing into my mouth and everything. Then they said it is actually, I am confirmed it is COVID. So I had to admit it, but they had no place for COVID. So I had to wait, and my daughter she had some friends in other doctor, so she told me, you please wait, I will get it admission in some other hospital. So after one day, I was in the ICU, and then she took me to another hospital, that is Bethany Hospital, that is close to my house, and I know the hospital also. There I was put in a hall along with 3 or 4 other people, and somehow I could manage. I had a fall from the bed at 2 a.m. I could not get up again. I was scrambling all over, and I could not get up. My wife helped me somehow, and then I could somehow reach, and my bladder was full. I could not do anything. The next day morning, we got admitted into the hospital. We were staying alone. We were only myself and my wife. So we called my daughter from Chennai. So she also came. And they took me to around at 12 a.m. to the hospital. And there they did a lot of tests. And they said it is confirmed COVID, but we have no place, so you have to go to another hospital. So with her friends, she took me to Bethany Hospital in Thane, where they took MRI and everything, and in the MRI they found out that I was having it was confirmed I had Parkinson's. And that is the first time I came across Parkinson's and also this Syndopa tablet. But Syndopa tablet did not suit me. I was vomiting and I was actually out every time I was eating something, and before or after food, then it will come out. So then the doctor told me, you change it and then you take it after food. So I started taking after food. Then I was there in the Bethany for about a week, and the doctors advised me that it's not a very serious case, so you can go home in about a week. Then after 1 week, my daughter told me, now you see it is too much, we cannot come every now and then, so you better come to Chennai. We are only two. So he said, no, you shift to Chennai. So we decided to shift to Chennai. And you'll not believe, in about 15 days, I could do everything, packing everything. I sold my car, I sold my, all other things, many things, and we got a transport company to transport everything to Chennai. So we shifted to Chennai in about 15 days' time. Because I was in Thane for almost 60 years. 60 years. So then it was very difficult for me to leave everything and come. After being diagnosed by Parkinson's, there we came across Sudha and this Parivarthan for Parkinson for my daughter in London. We had gone to London for about a week, about 2 months. So she said there is some Parkinson's group in Chennai. Why don't you try them? So we saw her one of her programs online, and we decided that we'll meet her. And then when I came back, we met her, and then we were after that I have under the care of Sudha and her company. Sudha has been very good to me, and then she has good to everybody, and we have got good physiotherapists like Raji and Kavi. So I was doing the therapy sessions and everything. And we had one Anita. She was also very helpful to us when I came to the place. We have people like, we call her Annapurneshwari, because in Sangeeta, whenever people come to the hospital, she gives the water, and then while going also they give her food and everything. So she's our, support in Parivarthan, and very lucky to have an umbrella like Parivarthan. I am there for the last 2 to 3 years, and I have not had any regrets. And after that, I had decided to go to Kottakkal, because I had other problems also, like what do you call, trigeminal illness, neurology, and another constipation. And Kottakkal, they treated me with Dhara and massages and everything. So I was there for 14 days in 2003, and then again 14 days last year. That helped, that made me walk again. I could walk. I'm still taking their medicines, and along with Syndopa and other medicines from the doctor also. I continue with my physiotherapy in Parivarthan, 2 or 3 days a week with Raji and Kavi, and I have no problem now. I can walk properly. Now I do every day 10-15 days, 15 minutes of walking. If possible, every day or whenever I can. before I came to Chennai, I was, no, no, it's okay. I was working in a company like administration manager, and then from there I shifted to, I had joined a partnership company as a builder, real estate development. So we developed places in Thane, Kalyan, and Lonavala. So I could drive to Lonavala every day for 2 years, to and fro, 100 kilometers every day I was driving. And I had no problem in driving. And after that, I now I am spending my time, as my wife says, eating in and sleeping. Nothing else to do. In between, I had a lot of other engagements also. Like I was president of Rotary for a year in the centennial year, and we did tremendous work. I did about 2,000 cataract surgeries with one doctor, Haldipurkar in Parel. And also I had done some check dam construction in next district, where we used to go every day, and I collected a lot of money during that program. And so we also called the governor of Maharashtra at that time to our club. That is the only one area where we could not do anything. That's about myself. I don't want to talk much more about it. I think we have other people waiting. I want to hear the doctors. Thank you very much.
Thank you so much, sir. Inspire us through your journey. I am delighted to introduce Sudha Mayappan, founder of our organization Parivarthan for Parkinsons Foundation. She is an economist by profession, but indeed a dedicated social worker. Passionately, she is running this organization more than a decade. Today, she is going to share a small brief about Parivarthan for Parkinsons Foundation. So let's give her a warm welcome to the stage.
I'll use this. Hi, everybody. Thank you for coming. A lot of familiar faces, lot of new faces, lot of new friends. So welcome all. I would like to welcome Saraswati and Dr. Sudhir, who graciously agreed. I will just quickly go through, go to the next slide, Sridhar. So keep this in mind when I talk. Look at all these faces, and I'm sure there are a lot of you here in the audience who are also up there. This is the face of Parkinson's, right? We just heard Mr. Janardhanan speak. He shared such a touching story about his life. For 1 minute, I want all of you to imagine a 70-year-old, 75-year-old man living alone with his wife, who would herself be maybe in her 70s or in her 60s. Both of them having health issues, the gentleman especially having Parkinson's. Now imagine him waking up in the middle of the night to use the restroom. He goes into the restroom, it's dark, he's having difficulty walking, he stumbles and he falls. There are only two of them living at home. He can't shout asking for help, he has speech difficulty. He can't get up on his own because he has Parkinson's and his movements are compromised. Now, this is a situation of almost 60 to 70% of our members who are aged and living alone. Kids are mostly abroad or not living with them in the same house for whatever obvious reasons. Now, for somebody like this, it is very difficult and very scary to manage the disorder on their own, especially when both of them are older. Parkinson's strikes older people generally, but these days we are seeing an increase in incidence in people even in their 50s. This is the second largest neurological disorder, and it is only rising, almost like a pandemic. Now, yeah, almost 95% of them who have been diagnosed, you just heard sir say, he heard of the word Parkinson's when he first got diagnosed, when he went to check for his COVID. That's how most of them find out. They have some secondary problem, shoulder ache, slowness in walking. They go to the doctor, and the announcement is you have Parkinson's. And they don't even know what Parkinson's is. Again, to re-emphasize, second largest neurological disorder in the world. Next slide. So globally, if you see, of course, these numbers are just numbers. There is no data, especially behind, there is no source or authentic data behind the numbers in India. Just to give you a global context, right? The disorder is highly prevalent in developed world, maybe mostly because there is awareness, maybe there is also earlier diagnosis. In India, much less so. To give you the size, the scale of the disorder, almost Parivarthan itself has seen close to 500 to 600 people affected with Parkinson's. Just one NGO in one state, in one city has seen this many members, right? Out of this, we personally have worked with, Dana and I, including others, we must have worked with closely, maybe 300 of them. How many are able to come to the center, benefit from the therapy? Maybe 100. So imagine the scale of the disorder to how many can actually benefit from a community group. When the disorder is this large, when it is as complicated with its varied symptoms, there is hardly one NGO, one support group trying to cater to the needs of the amount of people who are affected with Parkinson's. And the neurologist, I can count with my one hand how many movement disorder neurologists are in Chennai. And I can also say we have 500 members with Parkinson's, right? So imagine the number of members with the number of doctors to the number of support community that we have. So the need is huge. The disorder is mega in its size. That is the idea I wanted to drive home with this slide. Next slide, please. Now, why did I start Parivarthan, right? I mean, I always start the story with my father. Nothing to do with Parkinson's, of course. He had a brain hemorrhage in 2010 when I was just leading a very happy-go-lucky life in the US, not even knowing anything about health, even how to spell health. Then he got brain hemorrhage. I didn't even know what hemorrhage meant. Brain and hemorrhage sounded scary, so I came back. And then 4 years he was bedridden. I was a caregiver, somebody even as educated and who is connected like us. It was a very scary and difficult phase to just take care of him, right? Where do you get the resources? Are you giving the best treatment as a caregiver? That's the eternal worry. Next slide. So at that time, I want to acknowledge Rama here. There used to be a community support group for caregivers like us, like any disorder. Now this is only Parkinson's, but when Rama started it, it was for any caregiver, cancer, neuro, ortho issues. If you're a chronic or an acute caregiver, it was a wonderful initiative. It was there 10 years back. Fortunately, Rama is with us today, but she'll always cringe if I make her to stand, but if you do, it'll be wonderful, Rama. So in that support group, she's just waving. Yeah, she's come with her father. So I don't have Rama's picture here because those days, you know, it was not as documented. But one of the reasons or one of the main reasons for starting is Rama. I met Mr. Vasudevan in her support group meeting where Saraswati was giving a yoga demonstration. So we have come a full circle. 10 years later, Rama is with us today, Saraswati is with us today. And I don't know if Mr. Vasudevan has come in. He said he's coming in later. Okay, they're waving from the back. Hi, sir. I've not put up so many pictures of mine because of hubris, but this is to show how much Mr. Vasudevan talks to me all the time, telling me to do certain things with Parivarthan. He's like, have you written the book? Have you organized this program? Are you doing this? Are you not doing that? So I'm constantly getting instructions from him 10 years down the line. Without him, he was the first one I met with Parkinson's, and now it is 10 years our journey, and I have met so many people with Parkinson's because of Sir. Next slide. Yeah. So this is pretty much how our demography is divided in Parivarthan. Most of our members, because we are here, most of our members are based in Chennai. But increasingly, we've had in Tamil Nadu, outside Chennai, quite a sizable population. I would say Madurai and Coimbatore may be next largest in number. Only because the reach is more, not because the incidence is more. We've also had pockets in Bombay, in Delhi. So you should also have this picture in mind, right? Who is reaching out to us? Who is very familiar with social media, who can read English, maybe who read the Hindu newspaper, right? And hence the population is, the demography is also very urban, mostly affluent. if not very affluent, right? So if you are a taxi driver or if you're working as a house help, there is no way that they can find us. Extremely unfortunate. And even we do not have the means to serve. If they all come into us, the financial means for us to serve them would also be immense. So this is where we are right now in terms of demography. Next slide. So just in terms of our own footprint, right? As I said, currently we have over 400 members. But if you say active, who definitely benefit from up therapies, maybe I can say 100 realistically. Over the years, immense amount. In fact, with Lakshmi, who is here, we started out a yoga therapy program in 2015, and Lakshmi was part of the first batch with Saraswati, who was doing Yoga Vaidya program. She alone must have seen close to 10 to 15 members, if not more, and she has guided many more. So we took a list of members just before this event to see how many people got customized yoga therapy at Parivarthan through Yoga Vahini. It's close to 60 members. While the number 60 sounds smaller, but it's actually a huge number, just given the sheer challenge of giving customized therapy to somebody who has a movement disorder and who has to come to a certain place to get the therapy done. So in terms of footprint, that is yoga. And last year we started our supportive care center, where we provide, of course, all therapies have always been free, but we have our own center now. And I have to acknowledge thanks to one of our members who has given us their space. Every day we have free physiotherapy. Those two are our therapists there. They're testing out on each other before they give the therapy out. I don't know if our therapist has come here. I don't see her yet. Maybe she's not here. So we have a couple of members. That is Janardhan and sir getting some pain reduction treatment. Appointments are given, members come in every day, scheduled physiotherapy goes on. We have also added yoga therapy. Therapists come from all over, from Tiruvanmiyur, even further from Perungudi, all the way to Arumbakam, where our center is. Over 1,000 sessions have been done in just the last year with physio, yoga. We have counseling. We have speech therapy in association with SRM University. That's our footprint. Next slide. So when we started, I asked Mr. Vasudevan, it's been a year. I mean, it was not even a registered NGO that time. I said, sir, like 10 of us have been together for a year. Should we even do like an anniversary, something? He said, yeah, let's just go eat someplace. Let's do something. So that is me in 2015 with a bunch of members. You can see Mr. Narasimhan and his wife Malati also there. We went to Sarana Bhavan to have some lunch. That was way back. And now our team has grown, the members have grown, and I think our budgets have grown. So it's no longer Sarana Bhavan, but we go to some place fancy. So that is what it is. And just a smaller and most important, why Narasimhan Memorial Lecture? When I started in 2014 with Mr. Vasudevan, there were like 10 people or 9 people with Parkinson's who showed up on an August, literally in month of August afternoon, and everybody sat around and spoke about Parkinson's. That's the first time I'd heard how to even spell Parkinson's, what is Syndopa, what are the symptoms. One of the initial members was Mr. Narasimhan. His family is here. He was also one of our first members who had the DBS surgery done. So I'm plugging in Medtronics here, who the team is here. It is a brain implant surgery, which is highly helpful for people with Parkinson's, but not many are aware of it. There is a table with some information material that Medtronics has put out. Medtronics is a company that manufactures the implants. So they are here. If you're curious and want to check out, you can check that out also. So Sir was one of the first people I knew who had done the DBS surgery. And unfortunately, he was one of our first members who passed away. It affected me very deeply. I mean, those first 10 members, I would go to their houses regularly. I knew their stories back of my hand. I knew their families very well. And to lose somebody within a couple of years was a shock to my system. And we wanted to honor him. Such a dignified, most gracious, and one of the generous persons I know. So we wanted to honor him, and this was one way for us to commemorate by organizing a lecture in his name. So the first lecture was on deep brain stimulation, given by his doctor, Mr. Narasimhan's doctor, Dr. Roop, who came down all the way from Hyderabad. So that is us. Sir's family is here. Madam is here. Hello, madam. And his son, Mr. Vikram, is also here. Always happy to have you. So the idea of Parivarthan is to say that you could have Parkinson's. In the night, you might slip and fall. You will be alone at home, but we are just a phone call away to help you in any way we can. That is Parivarthan. Thank you so much.
Thank, uh, Thank you, Sudha, for guiding us through the overwhelming journey of Parivarthan, which was nothing short of inspiring and visually compelling testament to compassion. It is my honor to welcome Dr. Sudhir Ayyappan, a highly respected Ayurvedic physician with over 20 years of experience. Following the legacy of his Vaidya forefathers, he began his journey under his father, Dr. Ayyappan Kariyat, a distinguished 7th generation Ayurveda pediatrician, Bala Chikitsaka, and further trained with Ashtavedya, 8 branches, under renowned mentors including Vaidya Madho, sorry, Vaidya Madhom Rishikumaran Nambudiri from Kerala. I've spelled it correct, sir? Since 2010, he has been the chief consultant at Sri Hariyam Ayurveda, specializing in Panchakarma treatments and the successful treatment of food allergies. His deep knowledge, precise diagnosis, and compassionate approach to treatment make him a beloved healer. Beyond his medical practice, he is also an artist and musician and dedicates his weekends at Village Health Services near Chengalpettu. Please join me in welcoming Dr. Sudhir Ayyappan. Also, during the session, if you have any questions or queries, please note them down in your notepads. Our volunteers will collect them and they will be addressed by our speakers at the end.
Yeah, I think it's fine. Yeah. Good evening, friends. I'm Dr. Sudhir. You're able to hear me? Yeah. You have the PPT ready there. They've given me a very short time, but the topic is really vast and dense. It requires more time, but let me rush through the whatever information I can share with you in the short period. So basically, I'm from Kerala, from Guruvayur, but born and brought up in Chennai. Did my schools in school in IIT Madras, in Vanavani, and did my PG here in Chennai and UG in Manipal. So, though I come from a traditionally traditional ideas of pediatricians, I chose to do my masters in Panchakarma out of passion. So here the topic Madam has given me is Ayurveda in treating Parkinson's disorders. So Ayurveda, as you most of you are aware, if you're not aware, I like to show some light, throw some light into it. Ayu and Veda. Ayu means life and Veda means science. So as science, we can simply call it as science of life. It's the oldest medical science. Oldest means we don't know how old it is. The oldest text what we are reading are Charaka Samhita and Sushruta Samhita, which is about nearly 2000 to 2500 BC. Meaning these texts were written in 2500 BC, meaning the texts what we read and learn are complete. They are not like they have started the science in 2000 BC. So it's been a complete practical science with even surgical, different kind of surgical procedures has been documented and told in detail. Till the British period, we've been practicing surgery and everything, but after the British period, the surgery again vanished because of the change in the education system, but the medical the tradition still continues. So Ayurveda mainly has about 8 branches. These are different branches. I don't want to go into the details. Where the when you look at all these branches in Ayurveda, there are no specialists specific to the organs or systems. They are whole body healing process. So we treat the whole body as such. If you like general medicine or gynecology or pediatrics, all these things are whole body involved. There are no reductionist approaches in Ayurveda. Next slide, please. So most of you would have been aware with the Parkinson's modern definition, because the topic is Ayurveda and Parkinsons. Because in Ayurveda, there is no mention about Parkinson's. Parkinson's is a modern terminology. So let's try to draw some parallels between the condition and what's told in the Ayurvedic science. So the WHO defines it as a brain condition. Of course, the modern medicine tells it as a progressive neuro condition. So it's a progressive, it is going to affect the different nervous system. The major symptoms are, as most of you are aware about, the mobility part, the tremor part, the balance issues, or the other non-motor conditions what we normally face and see in the clinical practices, like dementia is a major concern there, and sensory issues and pain. All these things are there. Next slide, please. So, but WHO says, the PD, gets worse with time. There is no cure for it. There is no treatment for it, and it's just like the search ends there. Okay. So in a progressive neuro condition, there is not much to be done. If you are going to go with the version of the way the PDs has been portrayed in a particular way, then actually we don't have to go to the next slide. There is nothing much to be done, because already you'll be going through all different kinds of therapies, and then why there is a need to kind of search for other options? It's a question. So that's a very important thing I tell my patients. Limitation of a doctor is not the limitation of science. If you're not happy with a doctor, change the doctor. Don't change the system. Try all possible things of that particular system. And limitation of the science is not the limitation of yourself. You don't have a limit of healing. I've seen miraculous things happening with all patients of different kinds of conditions. There is no limit of healing when it comes to your own self. The doctor might say this is not curable. That is his limitation. Or the science would say this is not curable. Maybe that is the science limitation. But you shouldn't agree with anything. If you feel a gut feel there is something more, not happy with the Ayurveda doctor, change to a homeopathic doctor. Change to a Siddha doctor. Change to Reiki healing. Try all possibilities, because healing is possible. If you give up hope, then nothing is possible. So if there is a possibility for other options, if this is the version, then there is no possibility. What is the next possibility? Let's see. For that, we should understand how Indian system works. So Indian system, you don't have a neurodegenerative, progressive, that version of it. You have a different version of it, because it is based on a different biology. This is very important for people to understand, because people think, oh, okay, we have understood about the brain and the dopamine and other things, and that's a version, that's the only version that exists. No. There are different versions of biology. There is different versions of human models, evolutionary models, disease models. And it varies from, system to system. Indian system, mostly they follow the first three I've written, the Newtonian Darwinian germ theory model, is the allopathic model. It's a beautiful model. It works in whatever way it is. But you also have a different version to, different option, a different reality. Next slide, please. The Indian biology, which we are not taught in schools, sadly. Okay. So the Newtonian model is like the E is equal to M, E is equal to mc square, you are all aware. The energy and matter are interchangeable. You start seeing the body as a matter, that's the modern biology. You see it as a structure. But when you start seeing it as an energy field, then you enter into the bioenergy model, which is Ayurvedic model or Indian system of medicine models, where there are no structures involved there. There are energy fields. You have perceivable energies, imperceivable energies. Perceivable energies we call it as the tissues, the dhatus, sapta dhatus, the rasam, raktam, mamsam, medas, like that. And the malas, the waste products. The vata, pitta, kapha are the most subtlest and the base energies in which the body has been made. This is the model of the Ayurvedic concept. So if you tell me the neurodegenerative, that version is not seen here. So Ayurveda looks into a different perspective. Even yoga looks in a different perspective, because Indian system all follow the same Indian biology. Next slide, please. This is not currently relevant to the current PD, because it is about the different versions of the evolutionary model. You have a Darwinian model, the germs kill the thing, and you have a Kropotkian model. Next slide, please. This is very important. This we have seen that in the COVID time, when there was no treatments available for COVID. The Indian system came up with instantly with medicines. You have Kashayam, Nilavembu, or Indukantham and all. How were they able to they couldn't even decipher the virus before they started giving prescriptions. My friends used to call me and said, we have not even deciphered the virus. How are you people started writing the prescription? No, we have nothing to do with the germ theory there. We are not here to kill any germs or wipe off any germs here. We are only to strengthen the terrain. The Indian system is based on a terrain theory, where you start strengthening the terrain. You must be aware, all of you must be aware, that 80% of the people with COVID were asymptomatic. And 15% to 16% had mild to moderate symptoms. Only 2 to 3% had really bad symptoms, and 2% they passed away. So why is there so much of difference in the manifestation of the same disease, which germ theory cannot explain, which the terrain theory can explain? Next slide, please. So here what I'm trying to tell is there is multiple realities. You can see the body, view the body in different ways. So can they coexist? Yes, energy and matter coexist as two sides of the same coin. So do all the realities. So one version of the human body alone is scientific. If you say you try to prove the scientific relevance of Ayurveda, they say you people are not scientific. Yes, I agree with that. But based on what model? You are asking me to prove based on the modern model, which has nothing to do with the Ayurvedic basic things. So I cannot prove a quantum experiment inside an normal physics lab. It's not possible. So next slide, please. So when it comes to Ayurveda, the aim of Ayurveda is to maintain the health of the healthy and cure the disease of the disease. So the main good the definition about Ayurveda, it says about hita hitam sukham dukkham ayus tasya hita hitam. Hitam ayu, which is good for the ayu, which is bad for the ayu, which gives dukkham for the ayu, which gives sukham for the ayu. Whatever the science which explains about these ayu or the life is known as Ayurveda. Why is this definition important? Means we have patients coming with lots of blood tests and parameters. Everything is perfect. Still, they don't feel good about it. They said, my lab tests, everything is perfectly fine, but I don't feel good. What's my problem? Why are these tests not able to identify the problem there? They say, I told them, I educate them, telling this is only disease management system. This is not a health management system. It cannot measure health. The only way to measure health is the sense of well-being. If you feel healthy, you're healthy. That's known as sukham. In Ayurveda, in Kerala, they ask you, sukhamano. What do you mean by sukhamano? Sukhama irkingla kepanga illaya Tamil. Sukhama irkingla. So sukhama irkingla na arogyama irkingla nartham. You cannot ask the physician. They said, doctor, am I healthy? I said, you're asking the right question to the wrong person. I should be asking you, are you healthy? Next slide. So Ayurveda is based on a different model. It's not based on, like you have organ-based in modern medicines, like digestive system, respiratory system, circulatory system. Here, Ayurveda, the whole body is one organ made of different tissues, the saptadhatus. Next, please. The basic concepts comes from the Panchamahabhuta, where you have the 5 Mahabhutas forming into these bioenergies, the Vata, Pitta and Kapha, of which the Vata is a very important thing, which we will be focusing on for the sake of the PD. Okay, next slide, please. In Ayurveda, we can compare that with the Vata Roga. Vata Roga, most of these symptoms compared to with what we call as the Kampavata. Kampavata is a condition where you have many symptoms coming under the which is equivalent to PD. Why I see is next slide, please. These are the other next slide also, please. See. So these are 80 different possibilities of Vata manifestations. So of which it can come in any form. So these are imbalances which manifest in different forms. So in Ayurveda, you don't have PD as a particular disease. So we can compare that to the Vata Roga and depending on the manifestations. So if you ask do you have a treatment for PD, the Ayurveda doctor won't be able to answer that question. He will say depends. Depends on what? Depends on the spectrum. The spectrum in which they come. The stage and the other complications are different. The spectrum itself is different in Ayurveda. The PD can come in different spectrums in Ayurveda. See, if you take the COVID itself, COVID was not just the one fever manifestation in Ayurveda. It came under 4 different fever manifestations in Ayurveda. So it depends on what spectrum they come, the possibilities of cure also will change. Next slide, please. You are more aware about the modern treatments that's available in for PD. Starts with the Syndopa or Levodopa and dopamine antagonist and other things. You have successful surgeries also happening and rehabilitation facilities, therapies that's been happening at Parivarthan. All these things are very good. When it comes to Ayurveda, what can Ayurveda support? See, the main thing I told you, the Vata. When the Vata increases in the body, that bioenergy increases more than what is allowed. What is allowed means what is your body constitution. You are born with a particular percentage of Vata. Let's say you are born with 33%, let's say, or 50%, let's say. So if the percentage of Vata increases more than the allowed percentage in tremendous amount inside the body, those energies, then they start bringing in more of dryness and chalaguna, the movements, and vitiation of the other tissues, then it starts becoming a progressive condition. The progressive nature of any disease, not just PD, cancer, or any disease, is because of the element which is known as the Vata. Because that is a space and air element. It can expand easily. It doesn't need a channel to connect. It can move in. See, even you go to a place where there is more of Vayu there, then these discomforts will start increasing. It's very sensitive, more than the Kapha and the Pitta. It is more sensitive. Next slide, please. The curability. The curability, when you ask, these are the things what the physician will ask you. He has to go, see, I told you about the terrain theory. The important thing is not about the PD as a disease. The patient with the PD is more important for us. How the manifestation has happened in that person. That is more important. That will decide on the curability. If you ask me, is PD curable? Same thing I can ask. Let's work it out together. It will depend. No, previous one. The Prakriti. If you look at the Prakriti, you have Vata Prakriti, Pitta Prakriti, Kapha Prakriti. These are body constitutions in which when you're born with a particular combination of Vata, Pitta, and Kapha. If the Vata percentage is higher in that particular person, then the Vata Rogam, what you have got, will add to it. Then the curability becomes less. So there are 4 different curable stages. First is easily curable, which is curable with difficulty, which is manageable, and incurable. There are 4 different things. And I've seen PD in all 4 stages. All 4 stages. It will all first depend on the body constitution. If you are a Kapha person and you got this Vata Rogam, most of the time it is easily curable. But you have a Vata and Kapha involvement as a body constitution, and you got a PD, then it is curable with difficulty. It's going to take time. Or you have no Vata in your body constitution itself, then it becomes much easier. But then with age the Vata increases. After 60 years, the Vayu increases generally in the body. That's why the bone density drops down. You have dryness and the the porosity increases. All these things, Vata mostly manifests in the neuro and ortho spectrum. You can compare with that. Then the Vikriti means what are the other diseases which have been manifesting. So you have a stroke, and along with you got a paralysis along with a PD. Then you have two different Vata rogas involved. Then it becomes even more difficult for the disease to kind of get better. Desham, where do you live? That's also very important. Okay, they say, Kerala is a very beautiful place. Yeah, of course it is a beautiful place, but it's not a healthy place, especially for PD. Okay, because the place we call as Anupam Vata Bhuvisham, and the Anupa Desham, the place where there is a lot of rain and water stagnation, all these things, they are not the right place for a Vata Rogi. Any Vata condition, especially now we are talking about PD, if you are going to stay in a place where there is rain continuously, the conditions or the uneasiness related to the PD is going to increase there. And the balam, the strength of the patient. As you said, the older people have lesser strength, so the curability also weans off with age. Of course, if a person like Sir is there and he was able to walk and a brisk young man, so like him, if the balam is good, the progression of the disease gets arrested and the body will be able to sustain. Like Sir said, he went for 15 days of spiritual and he's able to walk comfortably. Not everybody get that result. There are people who are going year on year to Kottakkal and they don't get much results. Maybe they would have come from the other spectrum of conditions. And digestion. Good digestion, Agni is very important for the good manifestation. And diet. Diet, if you are going to, eat all spicy foods, junk foods, and have alcohol on every daily basis, and then you expect the Vata to come down, it's not going to happen. So if all these things are favorable, then you'll come under the curable category. Otherwise, it is a manageable condition. PG is a manageable condition. We can arrest the progression. But if we don't support, if you don't do what is best for the body to maintain the Vayu, then it moves into the incurable state. Next. There are many treatments that is available in Ayurveda. Most of you would have been aware of it. See, there are treatments like, Shiro Vasti, Nasyam, Vasti. It depends on, many of the treatments cannot be done if the age is, not on favor, because Vasti or Nasyam cannot be done with people after a particular age that needs a little bit of balam. But the other treatments, the external therapies can be done. They are always a supportive treatments, and they help. They are equally important like the internal medicines also. They help in arresting and improving the nervous system. Next slide, please. Of course, these are the few herbs which the patients themselves, they Google and come up with. They are telling it's more effective there because a lot of research has been done on the modern research-based things. So they have found the similar changes with the Sindopa-like kind of effect in these kind of herbs. But these four are being proven with the modern research. Okay, there are hundreds of herbs which works in PD. Next slide, please. So the diet, usually what is favorable, whatever reduces the Vata is very favorable to maintain. By and large, we recommend the patients to follow this kind of Vata Hara diet, which reduces the Vayu, like milk and buttermilk and non-vegetarian foods if they are non-vegetarians. And millets cannot be taken in large quantity, except for some barley and other things, because it's going to increase the Vayu there. And fruits, seasonal fruits can be taken. Ghee or the oil, that's very important thing, because the Vata, the main challenge is with the increase in the Ruksha Gunam or the dryness, which the ghee or the oil, right now there are a lot of research been happening with the coconut oil and the Parkinsons and dementia, that spectrum, because they are these, if we start adding, because of fear of cholesterol, we have cut down on the ghee and oils, and which is leading to more increase of the Vata, which is leading to the progression of the condition. Next slide, please. good lifestyle changes like regular oil bath, sleeping on time, all these things are Ayurveda strictly instructs, and it has given a very beautiful things what needs to be done on a dinacharya and ritucharya, like what you need to do on a daily basis and what you need to do on a seasonal basis. These are available in in Ayurveda texts. See, 50% of Ayurveda is for the lay public. It should have been included in our biology classes. Then 50% of your visits to the doctors would have been reduced. Next slide, please. Thank you.
Thank you, Dr. Sudhir, for taking us through the depth of our ancient medicine and its profound impact it can have on managing or reducing Parkinson's symptoms. It is now my privilege to welcome an esteemed pioneer in the field of yoga and yoga therapy, Saraswati Vasudevan ma'am. With nearly 35 years of experience, she has been a guiding force in personalizing yoga training, teaching, therapy, and research, carrying forward the rich tradition of Sri T. Krishnamacharya and Sri T. K.V. Desikachar. As the founder of Yoga Vahini, she has trained and mentored hundreds of yoga teachers and therapists worldwide, making holistic well being accessible to many. Beyond teaching, her contributions to research and her leadership roles, including her tenure on the board of directors at Yoga Alliance, have significantly shaped the yoga therapy community. Before we invite Saraswati ma'am to share her wisdom, I now call upon the team of yoga therapists to recite a chant setting a sacred and harmonious tone for the session. You can all sit comfortably with your head straight, hands relaxed, and body upright, yet at ease. Take a deep breath and let us center ourselves in the moment.
A very good evening, everyone. So let's sit straight, eyes closed, shoulders relaxed. Connect with your breath, slowly bringing complete attention to yourself. We will start with a prayer. You can join us. So inhale long and chant Om 3 times. Inhale again. One more time. Inhale. योगेन चित्तस्य पदेन वाचां मलं शरीरस्य च वैद्यकेन योपाकरोत्तं प्रवरं मुनीनां पतञ्जलिं प्राञ्जलिरानतोऽस्मि आबाहुपुरुषाकारं शङ्खचक्रासिधारिणं सहस्रशिरसं श्वेतं प्रणमामि पतञ्जलिं श्रीमते अनन्ताय नागराजाय नमो नमः। श्रीकृष्णवागीशयतीश्वराभ्यां सम्प्राप्त चक्राङ्कणभाष्यसारम् श्रीनूत्नरङ्गेन्द्रयतौ समर्पितस्वं श्रीकृष्णमार्यं गुरुवर्यमीढे विरोधे कार्तिके मासे शतताराकृतोदयं योगाचार्यं कृष्णमार्यं गुरुवर्यमहं भजे श्री गुरुभ्यो नमः Thank you. You can open your eyes now.
எல்லாருக்கும் வணக்கம். Thank you, Sudha, for this opportunity and for really starting this journey 10 years ago with all of us. And I really want to thank Lakshmi, who chanted. She's been one constant factor from 2015 until now, guiding so many of our therapists to teach people with Parkinson's, take care of the caregivers. And she's really been a very solid support in this project, without which we wouldn't have come so far. So thank you, Lakshmi, and the whole team that's been working. I just wanted to start with a small story. You know, my experience of working with a person with Parkinson's, which was almost 15 years ago, and I met a person in Hyderabad. So his wife was my student, and he was recently diagnosed with Parkinson's, so she asked me to come and teach him yoga. At that point, I didn't know what Parkinson's was so much. You know, we do study a little bit of it, but I haven't really worked with anybody. So I started working with him, trying to understand his symptoms and what is it that can really help. He was an Arjuna awardee. He was a sailor and highly, accomplished person. And for him, the diagnosis of Parkinson's came as a very big shock. So he was in a very deep state of depression when I met him. 3 months, 4 months down the line. So I was not living in Hyderabad. I used to visit once in 2 or 3 months, and I would go see him. He had a regular yoga teacher who would see him every day and give him some practice. So I used to include whatever I taught, he would continue to teach him through the weeks. So after 3 months, one day he said, "Yesterday I had a dream, and in my dream I smiled. And I have not smiled for so many years, and I have not had a dream where I smiled." And when he shared the dream, he smiled. And it was so beautiful. And for me, that really was a game changer, you know, to really look at, okay, this is a condition that is progressive, debilitating, with a lot of burden, not only on the person, on the family, on, of course, the larger community. And somebody like him, who had just forgotten to smile because of the problem, because he was doing some practice, something shifted. And dream is a much deeper state of consciousness. Yeah, it's a very subtle level of consciousness where he actually experienced that joy. And as he was sharing it, I was really tearing up, you know, when I heard him say that. And this was 15 years ago, and I still remember his face and what he said. So today I'm here to talk about the benefits of yoga for Parkinson's. And thank you, Dr. Sudhir. Much of what I wanted to base my presentation on has already been shared by him, because yoga and Ayurveda go together very well. And we really want to look at the individual as a person, not through the lens of the disease. It is a person who is more important, and the disease is there. Yeah, the problem is there, but we try and look at the person as a whole individual, and what is that we can offer the person. If you can breathe, you can practice yoga. This is a very famous quote by Sri T. Krishnamacharya, my teacher's teacher. Because there was really no other precondition for yoga practice. Usually people come to us and say, I'm not flexible, I can't touch the floor, or, I can't do this, I can't do that, so I can't practice yoga. But can you breathe consciously? Then you can practice yoga. Yeah, that is what Krishnamacharya said. So we have really been working with people with all kinds of problems. Depending on wherever they are, whatever they can do, we start from there and help them progress. So, no, still stay with that same slide. So the definition of yoga is yuj, comes from the root yuj, which means to bring together. And here we are trying to bring together the body and the mind and the breath. So the breath is the catalyst. And the breath is the most important primary expression of the vital energy prana, what Dr. Sudhir was talking about. Yeah, the whole thing is an energy system. Body is solidified prana, mind is a very subtle level of prana. So bringing together the prana, where the gross body and the more subtle mind, using the breath as a bridge. This is what we do through yoga. Now this coming together has to be harmonized. So harmonizing the whole system, it's like tuning an instrument, right? And what are we talking about when we say harmonize? Harmonizing the prana. So we have 5 pranas in our system, 5 major pranas. Again, drawing from Ayurveda. Each have different seats, different functions and different direction for flow. So what we try and do, because PD is a Vata related condition and Vata is prana, yeah. So we try and work with practice so that we can harmonize the prana. That is what we are doing through yoga. And we begin with the body. We have to begin with what is gross, what is tangible, what somebody can see, experience and work with. Because prana is not something you can see, yeah. Only through the actions you can experience the prana. And breath becomes the key. So all those of you who have been doing some yoga therapy with our therapists, you would have heard them tell you again and again and again, breath. Pay attention to your breath, breathe. Really focus on your inhalation, especially your exhalation. Relax. Because the breath is really the key, and the breath has a very powerful way of calming the mind. So it's not only helping you with a whole range of physical, physiological functions, it is also helping the mind to become calm. And yoga is simply a quiet, clear mind. It is all about the mind. Because we usually think yoga is about doing some postures, yeah, Surya Namaskar or something difficult. But that's only one aspect of yoga. It is primarily the breath that helps to influence the body and the mind, and this whole thing cannot be separated also. Yoga or Sankhya does not separate body and mind. It is one continuum, yeah. So we work with people one-on-one. It's an individualized practice, and we do a thorough consultation. We try to understand the person, like I said, and the way we try and understand the person is through the Panchamaya model, again drawn from the Taittiriya Upanishad. So we are made up of 5 sheets or 5 layers or 5 dimensions. At a gross level, it is the Annamaya. So I'm not going into the details of the symptoms. You can see it on the screen, and Dr. Sudhir has also gone through it. Many of you are more than familiar with it. Then the Pranamaya, we look at the energy, we look at sleep, we look at many of the other physiological functions, of course the breath. And then the Manomaya, where the fear and the anxiety and the depression and other cognitive functions, cognitive issues, all of that come. Of course, a busy mind. Yeah, who doesn't have a busy mind? It's not very specific to PD. Everybody has a busy mind. And we're just getting busier and busier up here. So the whole purpose of yoga is to really calm the mind. Okay, and that has a very powerful effect on the whole system. And of course, I didn't bring in the other 2 layers, the Vijnanamaya and the Anandamaya, which often get clouded by the busyness of the mind and the problems at the Annamaya and Pranamaya level. So that is a Heyam. We understand the person through questioning, through dialogue, and through observation in a very, very detailed manner. Our therapists get trained for 5 years to do yoga therapy. It is not just learning some technique and teaching. Yeah. Then we look at the causative factors. Like Dr. Sudhir was talking about, how do you understand the person, their prakriti, their food habits, their lifestyle, what has been their lifestyle so far? Was it something that actually could have increased the vayu? So all these factors are also taken into account, yeah? Side effects of medication, the condition itself which is degenerative in nature, and of course environmental factors which brings in stress that is caused by the work front or family situation, and all of those factors. We also look at the use of pesticides and other toxins, heavy metals. By the way, my first student, he actually owned a aluminum fabrication factory. Okay, and every day he worked in that. He would go there to supervise, and perhaps that was one of the reasons why he could have got the disease. Then we set the goal. So based on where the person is, what is that they can do, what is that they can't do, what are their symptoms, and what is their strength also, what is that they are good at. We are trying to use all of that to establish short-term and long-term goals. So immediate goals will be improve energy level, work on sleep, improve the appetite, address constipation, pain, aches and pains. We have students who come each time with a different kind of pain. Sometimes it will be shoulder, sometimes it will be back, sometimes it will be knee pain. So each time we'll have to look at the person and what is it that we can do through the right kind of asana, pranayama practice that will address these symptoms, that is short term. But we also keep in mind that we are taking them forward. The long term goals is to establish good improvement and to maintain that, stabilize that, sustain that. It's not like you get better and you stop the practice. Yeah. We also want to work on delaying the progression of PD. So if somebody comes very early intervention, it is a great way to actually even delay taking medication. Let's say they come at the stage of 1, where they hardly have any symptoms. We could simply work with yoga practice and maybe some Ayurveda, where we can delay the intake of medicines until they actually start needing the medication. Yeah? Managing off time. Initially, we give practice during on time, which is after they have taken the medication. When they are feeling better, we give them the practice so they can do it well. Later, slowly, we start asking them to do the practice during off time. And they actually start reducing the symptoms of the off time. Yeah? So that is what we have seen with yoga. Of course, building emotional resilience, and of course, learning to look beyond the condition. Like, don't define oneself as PD. Yeah, you are more than the disease. And how do you learn to look at yourself beyond the condition? We also want to move the person to the Vijnanamaya and Anandamaya. So really to connect something deeper and that which is more eternal beyond the body. So how do we give practices and how do we help the person to connect with something at a spiritual level? Yeah. Now, before going into the actual intervention, I want to list down the benefits that we have seen in the last 10 years working with people with Parkinson's. We can say managing tremors and dyskinesia. Okay, it's not like the tremors go away or they magically disappear. And if people come to us saying, I have this problem and it has to go away in 1 week or 2 weeks or 1 month, that is not going to happen. Yeah, because there are so many factors that are impacting the individual. But we have seen definitely, all of us can vouch for it, when a student walks into class, there will be a lot of dyskinesia, a lot of involuntary movements. By the time they finish the practice, it's almost like a different person is walking out. So much more stable, so much more calm, and hardly any movement you can see. Yeah, that is the effect of a practice. And so the practice has to be every day, regular, and slowly they can see improvement in their tremors and dyskinesia. Balance improves. We also use simple balancing postures that they can do to improve balance and gait movement. So when the shuffling gait is reduced, the tendency to fall is also reduced and they become more confident. Sleep and energy levels definitely improve. Constipation, no need to take laxatives after a point because they're able to manage constipation with practice. Speech improves, some of them chant well, some of them have gone back to singing also. Reduction in aches and pains, and this is something that we see every time they come with a different kind of pain and they get better. Increased bladder control is also a reason why the sleep improves. They don't have to get up and go to the toilet very often. Mental well-being improves. They become happier. You remember the student who said, I smiled in my dream. So that is an improvement in the mental well-being, and discernible drop in the off time. So the reduction in the off time symptoms is what we have seen significantly changes, improves. Social interaction. So people are a little more confident to go out, to meet family, go out to functions. There is more enthusiasm for that because they feel much more confident with the practice. Now the intervention. I'm just going to go very briefly, very quickly through this, and then hopefully we'll have some time for practice that all of you can try. Okay, so this is a highly individualized practice in this tradition of Sri T. Krishnamacharya and Sri T. K. Vidyasekachar, where asanas are chosen and they're modified for the individual with breath regulation. And there are so many different ways of using the 4 components of the breath: inhalation, exhalation, holding the breath after inhalation, holding the breath after exhalation. And there are so many ways that we can use these 4 components in asana practice and of course in pranayama. So stage 1 to 2, where there are not many symptoms. Now I want to say that we don't strictly go by stage wise. We are not putting people into specific buckets and say, oh, you're stage 1, you're stage 2. We cannot do that because each individual is very, very different, and the manifestation also keeps changing constantly. But let's say we have somebody with very minimal symptoms and they're not on medication and they're able to function normally in their daily life. They don't need much support. That is a good time to really do preventive care. Okay? To what extent you can really work with the prana, regularize and harmonize the prana, putting it into order using practice. And we call it Sarva Anga Sadhana, which means we have to work with all movements of the spine. We have to work with standing postures, lying postures, seated postures, maybe some mild inversions also. And all of that can be used as a complete practice. So the entire system is worked, not just the Annamaya, but the Pranamaya, Manomaya, the Vijnanamaya and the Anandamaya. All aspects we work. Breathing, as I said, is the key. Some simple practices we have used consistently have shown a lot of improvement in calming the mind, calming the body, relaxing the body, and also improving sleep, improving stability in the body. There is a sutra in the 3rd chapter of Yoga Sutra which says Kurmanadyam Sthairyam. Kurmanadi, which is a nadi that is located in the chest area, which is also the seat of the Vyanavayu, which is responsible for movement, sensation, etc. So to work on this area, we work with some postures, modify them, use the breath appropriately so that we can stabilize the individual. So all of these, we still go back to the ancient texts and work with the wisdom that is there. We use chanting to improve exhalation, to calm the mind, to focus the mind, and bhavana. So bhavana is what you fill your mind with. So otherwise, the mind will go everywhere. So we say, really focus on this, visualize this. Visualize that you're drawing the energy from the earth. And visualize that you are letting go of all your problems and just offering it to Mother Earth. It could be your connection to a favorite deity. It could be your connection to nature or a particular element in nature. And all of that is actually built into the practice so that the person's mind really gravitate towards it and they're able to really enjoy the practice. See, if you don't enjoy something, you're not going to do it, right? So it's not just making time and doing it like a chore, but really enjoying it, looking forward to it. So bhavana becomes a very important part of the practice. Of course, diet and lifestyle modification, which of course we draw a lot from Ayurveda. So our students study with Dr. Sudhir and Dr. Meera, his wife. We study Ayurveda. We also try to practice as much as we can in our daily life with the food and lifestyle and all of that. So that's something that we go back to again and again. Engaging in recreational activities. So, of course, Parivarthan is doing quite a lot in that area, which is very important. You know, we are social beings. We really want to live a full life. And how, in spite of the problem, can you live a full life? That's what we look at. And encouraging writing, journaling. So, using your hand to write. So, the motor coordination, the fine motor skills, all of that we try to encourage. So this will become part of the practice. Every day you do not only do a practice, but you also write something about your experience with the practice. Yeah. So these are some of the practices. You see that there is seated, standing. We use some support like a table or a wall for some of the movements. You can see some lying postures also. So of course this is a big jumble of a lot of postures, but we will choose a few from here and ask you to do the practice also, so you have a first-hand experience of that. This is for stage 1 and 2. Then stage 2 and 3, already the symptoms are increasing. By stage 3, maybe they have to go on medication, and they will need a little more support. It starts affecting the mind, they start worrying about it. So at this stage, we continue to work with stage 1 and 2, but whatever the person is able to do now with a little more support. Now remember, in physiotherapy also you have this, what we call the closed chain movement, right? So if you are keeping your hands on the wall and do some movement, the mind gets the cue that you are supported. So there is better stability. So sometimes it need not be keeping your hands, it can be just touching a finger on the wall, and the mind gets a cue that you are supported, and already there is a great amount of stability in the body. So we use this in asana practice. We use a wall support, we use table, we use different simple props that everybody can use at home, have at home. Everybody has a wall, hopefully. We have some table, chair, something. Yeah, we can use that to work with the practice. Mudras. So Lakshmi says that they have been working a lot with the Adi Mudra. All of you can try this. So fold the thumb against the base of the ring finger, fold the other fingers, yeah, and place it on your lap. Just place it on your lap, up or down, yeah. Just take a few breaths. Just inhale and exhale. Keep it down on your lap, yeah. You can put your pen down and all that. Just do the Adi Mudra, yeah. Just take a few breaths. Everybody can do that. Like this. Okay, yeah. So sometimes people, when they come into the class, they would have traveled by auto or car or bus, and then there's a lot of agitation in the system. You know, just doing this, sitting quietly and breathing, already the whole system will settle down. When the body settles down, the mind will begin to relax. Yeah. You can release your hand. Now this, they say you have to do it from 5 minutes to 10 minutes. So you can do it when you're just even watching something. But it's not like your mind should be somewhere and you do this. You have to be attentive. You can do it when you are doing your pranayama or your meditation. Yeah. Nyasam is another practice where, of course, can you have your hands up like this? One hand. Okay. When you inhale, just run the thumb to the tip of the index finger. Exhale, thumb down the index finger to the base. That's all. Then the second finger. Inhale, exhale. Inhale, exhale. Very good. Last finger. Inhale, exhale. Now you don't have to hold your hand up. You can place it on your lap. You can do it in lying position, in seated position. We also do it sometimes in standing position. So Nyasam, the 5 fingers have a very important big representation in the brain. So it helps your whole nervous system to relax, and each of these fingers also represent a particular element in the body. The thumb represents the fire element, tell me if I am wrong. Okay, index finger, air element, the middle finger, Akasha, space element, the ring finger, Prithvi, earth element, and this is a water element. That's why children say I have to go like this, water element, yeah. So these 5 elements, when you do the different mudras, they really have an impact on the system. In our tradition, we have not studied the mudras in detail, so I'm not an expert in this area, but I'm just taking the cue from people like Lakshmi who have been working a lot with the PD and these mudras. A calming night practice, not only a morning practice, a very relaxing night practice that can help the person to sleep better. So stage 2 and 3, again, all these possibilities and more. So there are many, many asanas, but we just use around 15 to 20 asanas, that is enough. But there are innumerable possibilities, innumerable ways in which we can modify each asana for that individual, okay, and also progress. Then stage 4 and 5, of course, it's an advanced stage. Maybe the person needs a lot of help to move around. Sometimes they're wheelchair bound or they're not able to get up. Still, we can do something. Still, we can do some practice, mostly seated, lying, and help the person to relax, really work with the mind, you know, and work with sounds, work with calming breathing practices. Maybe shorter practices through the day that will help the person to calm down and just do whatever they can as a practice, okay? Yeah, so all these are taken from our course sheets, what we give the student, okay? This is not just randomly we have conceived from my head, it's what we have given, what we have really seen works for the people, yeah? Then there are other suggested practices, again drawing from Ayurveda, regular physical exercise. Even research has proved that regular physical exercise really helps to delay the progression of the condition and improves many motor or non-motor symptoms. So apart from yoga, we ask people to walk, and any other physical activity that they can do is also good to do. If they have the time, make the time for it. Oil application and oil bath to reduce the vata. Appropriate balanced diet. You looked at all the different foods that help to reduce vata. Engage in mentally stimulating activities. I saw in the video there are so many different activities that are given by Parivarthan. So all that is very important. Journaling, socializing, and not to forget the caregiver. Now, very often a caregiver says, no, that person is important. I've come only for that person. I don't have to do anything. Let me tell you, the caregiver needs as much yoga as the person with PD. It's extremely important that you make time for yourself and do some practice. Yeah? And other things like checking the vision and all of that, going back to the doctor for checkups, decluttering your space, all of that. Yeah? So I just want Lakshmi to share one or two things, okay?
So just adding to what Saris ma'am said, so just wanted to share some beautiful stories, something that my students have shared with me. So there was this gentleman who is present here today who actually came with his son, and he would feel like he's flying away on a motorbike. He would cling on to his son when he would come for sessions, and he would say that I'm literally flying away when I come. And this happened for a couple of sessions, and one fine day I see that he is walking straight and coming in. And when I asked him, how did you come? And the son was not to be seen. He said that I took an auto and I came on my own. So that is very empowering to see that the person could do this all by himself. There is another lady who still continues to send me bhajans every day, who had slurring issues, who had some hallucination, so which was coming in the way of her singing. There was also other problems, but with some regular practice, the credit definitely goes to them because they show that Shraddha to practice every day and they connect. If we had some more time, I would have shared the bhajans that she shares with me every day. Now she can sing with an open throat and she's so happy. She has also started playing her veena, which she had stopped. So I can just go on and on like this. But to just one last thing, I also worked with a gentleman whose photo is there with me. He is my first student. Uh, so I worked with him right till the end. So he was just diagnosed when I met him. And we had spoken about something called visualization, which ma'am had mentioned, the Kurma Nadi visualization, the center of the chest. So if you meet a therapist, so they can guide you with a practice. So just visualizing, which improves your body language, gives you some kind of an internal strength, helps you connect with the breath. Yeah, so that's the practice we started off with. He would use that systematically. So he was continuing to work till the end. Whenever he would go for a meeting, he would sit there, do that breathing just to compose himself, and then he would conduct a meeting and he would come back. Then he unfortunately had a fall. He broke his hip and he was bedridden for some time. And that is when his caregiver would give me a call, send me message saying that he still continues to do that breathing, and which is really helping him. Yeah, so these are some very touching stories, which I really cherish. Thank you so much.
Okay, so we'll go to the practice now. Sorry, I took a lot of time. Can we have a therapist? So, 5 minutes practice, okay. So we'll do one standing and one seated, okay? Whoever can stand, maybe you can, some of you can move to the aisle. Stand, just stand. Yeah, maybe some of you can move to the front or over the caregivers, some of you can move. This is for everyone, okay? So this is Tadasana modified and we're going to do it with Nyasam. So you're going to just, for each movement, you're going to do first movement, thumb with the index, then like this, then third finger and fourth finger, okay? So Meenakshi is going to demonstrate. As you inhale, just hold your thumb and index finger. Just move your hands a little away from your body as you inhale. And then as you chant Om, bring the hand back down. One more time. Inhale, just a little away from the body. Inhale. Now second finger, little more, maybe up to the shoulder level. Inhale, open up the chest, yeah. Wonderful, one more time. Third finger, you try and take it above the shoulder. Inhale. Now a full stretch, last finger, all the way up. Excellent. You can all sit down now. We'll do one more small breathing. Yeah. Simple, isn't it? It's not complicated. Anybody can do these things, yeah? With some modification depending on what we are able to do or not able to do. Who's going to come for the seated? Aparna, yeah. So we are going to use the three parts of Om, A, U and M. Okay, as you inhale, so you're doing something very similar in seated. You just open your arms. As you inhale, really open the chest, feel the lengthening of the spine. Bring the hands to the abdomen. Bring the hands to the abdomen. Yeah, one more time. Inhale. கையை வந்து வைத்து கொண்டு வாங்க. Okay, one more time. Inhale. Now raise arms a little higher as you inhale. You're going to do O and bring the hands to the chest. O. Okay, the seat of the Kurmanadi. Inhale. O. One more time. O. The third is Im, just humming, and you bring the hands to the throat, base of the throat. Don't hold the neck, base of the throat. Okay? So inhale. You can do it with your eyes closed if you have got the movement. Inhale. Bring your hands down. Just sit with your eyes closed for a minute. Okay, thank you.
Thank you, Saraswati ma'am, for leading us through the journey of mindful awakening and demonstrating the profound impact of yoga on Parkinson's disease. Please have a seat. Now I invite Sudha and Dr. Sudhir Ayyappan to join us on the stage, and I request the volunteers to collect questions from the audience as we prepare to begin the Q&A session. So if you have any questions, our volunteers are here. You can raise your hands, they will collect the questions from you. Mr. Vikram, Narasimhan sir's son, would like to share a few words.
Hello all, good evening. My name is Vikram. First of all, thank you so much Ms. Sudha and Parivarthan for making this, honoring my father and making this an annual event. Our family is so thankful for this, and thank you so much Doctor and Madam for such an informative session. My dad used to say, my dad used to say that God is the best engineer because human body is such an amazing creation. So both of you touched the fundamental concepts but made it, put it in a simple term so that we all can understand. Thank you so much again. So my dad, my father and his father both had Parkinson's. So when my father was diagnosed, so we knew what to expect and what not. And I was not home. So when my father mentioned about Parivarthan, he found a shoulder to lean on, and he found like-minded people to share his thoughts, to discuss treatments, and everything. So Parivarthan was more like an extended family to him during his Parkinson's days, and it gave him a sense of belongingness. And thank you so much again for for all the help and support that Parivarthan gave to our family. So yeah, thank you so much. And on a lighter note, wherever he is, he's going to be laughing out loud because uh, when I was not home, very first time he spoke about Parkinson's and the help and support, I was like, what is the catch? Why will someone support and help people without expecting anything in return? I asked him to be very, very careful about this and whatnot. So now I am on the stage talking after a lecture arranged in his name by the organization that I asked him to be watchful and be careful for. So he's going to be laughing about such an ignorance. And so, anyways, thank you so much, Ms. Sudha and Parivarthan, and thank you all. Thank you so much.
Okay,
Thank you
thanks,
so much,
thanks,
sir.
Vikram. We are going to take some questions. So I'll just tell Modaliya Soli Ranga. So what is the cause for PD, PD dementia? கொஞ்சம் அந்த மாதிரி medical இதில் இன்னைக்கு நாங்கள் போகல. We are not going to explain those things today. Just keeping it more to Ayurveda and Parkinsons. Please take the mic. More questions directed. I'll just go with Dr. Sudhir's questions first. Is it, okay, well, simple, I'll start. Is Vata worsened by raw vegetables? Yeah. Vata, does it increase due to eating raw vegetables? Yeah.
Yeah, it increases with raw vegetables, raw salads. Vegetables as such, they increase vayu. So especially the roots and the like potatoes and yams, all these things, they increase the vayu more than the other vegetables. Watery vegetables are more preferable, and tree vegetables are also good, but that's why the vegetables have to be processed with some ghee or oil to reduce the intensity of its impact on the vata.
Doctor, another common question is, can Sindopa, the allopathy medicine, be taken with Ayurvedic medication?
See, in my practice, there are no studies that it's been happening with whether Sindopa can be taken, but it's only a supplement that's happening. There are no known interactions with any of the Ayurvedic medicines. And if there are other complications of other medicines they are taking, we need to be careful with that. So Ayurvedic medicines, they are like herbs only. The herbs are just like a food only. They don't interact with chemicals, but preferably we ask them to space. Don't take allopathic and Ayurveda at the same time. You need to have at least a space between these medicines so that the efficacy of each medicines are not disturbed. Okay, so the Ayurvedic medicines work like food. They have to get digested, and then only they start acting. It's not like they enter into your bloodstream and start working. So the allopathic certain medicines, like if they are taking thyroid, we ask them to take first the thyroid. It will get absorbed first. Most of the Ayurvedic medicines will be on empty stomach for better efficacy. So you just have to space between them. That's all. But you can take allopathy and Ayurveda together. Certain drugs, like if you're taking on some immunosuppressants, other things, we ask them to stop for a period, like on steroids or certain medicines. Otherwise, Sindopa, these medicines are safer. They can be taken along with Ayurvedic medicines.
Doctor, if they have to get Ayurvedic medicine, should it be treated as an inpatient facility?
See, certain treatments like Vasti or bigger Panchakarma cleansing treatments needs in-house. Otherwise, like the Pirichal or the Shirodhara, all these things can be treated at outpatient itself. See, the treatment for PD is going to be a longer process, just like yoga or therapies and all. It is not like you take it for 15 days or 7 days and you're going to get better. It depends on the stage. Okay, so if it's mostly going to be like a maintenance, like once in 3 months or once in 6 months or once a year, depending on the stage, and it can be done as an outpatient.
Okay, thanks, doctor. So one of the members here is asking, the father is taken to bed and it's very difficult for him to walk. So can Ayurvedic medication or treatment help?
He's in the bed.
Yeah, he's taken to bed, 4 years taken to bed. Is there any scope of him to make him walk? The oil massage.
See, definitely at any stage the medicines are going to work. Okay, so whatever way it is going to work, or we cannot expect a reversal at that age, depends on the age and a bedridden person, but definitely we can improve the quality of life, like, improving the bladder controls and, the other uneasiness what the bedridden patient would be undergoing. Definitely we can work on that.
One question to Saraswati. How do you customize your yoga treatment to people? I think that's what your presentation was all about, but just in summary.
Yeah, so we do a thorough assessment of the person through observation, through asking questions, recording all the information about the person, what their major symptoms are, possibly looking at what could be the causes, what are the active causes, yeah, what is the diet, lifestyle. We try and understand everything, even their family context. And then we do some tests to see what kind of practice to give. Like what kind of asanas can they do safely? Can they do standing? Can they do seated, lying? First we try and understand, choose a few postures, modify them for the person, teach them with the breathing. And it is a long-term process. Okay, it's not like you come for a symptom, get better and you stop doing it. It is a chronic condition, so we need long-term intervention. So the practice itself is adapted to the changing needs of the individual. And ideally, we see a person once a week. We give a practice that we expect them to do every day at home. Sometimes we may have to see them more than once a week. We also do online consultation and classes.
Doctor, can Parkinson's be cured?
Cure is a big terminology. I cannot assure you that, but the possibility of healing lies within. The cure.
Well, how do you differentiate between curing and healing?
Healing is a process. Healing is a process. It's an ongoing process, just like the flow of the river. Body always moves towards health, never towards disease. Body is designed for self-healing. And what is the physician and the therapist are doing? They are only giving a helping hand. If the body is able to get up, it will get up.
So just to reiterate here, PD is not in Ayurvedic terms, but in allopathic terms, it's a neurodegenerative disorder. Cure might be a very big hope for Parkinson's, but good management of Parkinson's with appropriate Ayurvedic treatment and yoga practice is possible. Yeah. Doctor, if somebody has arthritis, will they have more chances of developing Parkinson's?
See, both come under the Vata spectrum, but the tissue levels are different. So they need not. But if both, if it happens in the same person, the recovery becomes difficult because the approaches are different and the choice of medicines are different. So because both are Vata rogas. So a person has a tendency towards more Vata roga means he's in the bigger spectrum. Then the possibility of recovery becomes difficult. If a person comes with arthritis and PD, I usually start with the arthritis first because that's more problematic and it involves multiple things because it's more faster progressive than the PD when it comes to an old people.
Okay. Doctor, one more final question maybe. Constipation is a big deal in Parkinson's. So what kind of food can be avoided? A member is asking, should I take wheat? Should I not take anything with wheat? Will that aggravate my constipation?
See, the wheat has been a big challenge in many conditions and it is connected to the food. The reason is because of the current wheat, which is the dwarf wheat, the hybrid wheat that is coming. But in the traditional wheat, we don't see the problem of constipation happening there, which is only 20% of India's production there. So maybe, the other foods which add to the constipation are the vata aggravating foods. Just like I said, there's sprouts and raw salads and more of spices like chilies and added to that. Those kind of foods without oil or ghee in the diet. You just boiled vegetables and that kind of things will going to add to the cost. If you can avoid those things, which aggravates the vayu, and also include more of fat in the diet. So the healthy fat like the coconut oil or the ghee. So those things can definitely improve the bowel movements. Instead of, you see, in PD and in old age, the problem is because of the dryness in the gut. There is no point in taking laxatives. It is going to further aggravate and the patient becomes dependent. The stronger dose they will be on and there is no relief. The more is to lubricate the gut. That's why, in PD and similar conditions of constipation, enema is indicated. Take oil enemas on a regular basis. That will, you can skip levels and lubricate the gut even faster than taking months and months of internal medication. Those things can be planned.
So, foods to avoid: raw food, salad, too much of millets, anything dry. Dry. But if they take a lot of ghee and coconut oil, will that not lead to cholesterol? It's a commonly
It's a
asked
good
question.
cholesterol. Ghee and coconut oil add only good cholesterols. Of course, it should be taken according to your digestive capacity.
Saraswati, one question for you, although I think you addressed it already. How long should somebody with Parkinson's practice yoga?
Yoga Sutra says Dirgha Kala Nairantarya, long time without interruption. You have to make it part of your lifestyle. It's not like a medicine. No, it has to become part of your life.
Somebody wants to know, how do they check Vata, Pitta and Kapha in their body? I don't think you can check, sir. Doctor has to check. What do you say? Or maybe they can check? I don't know.
You can check yourself.
Okay.
See, there are a lot of questionnaires available on the internet. You can fill those questions and, identify.
Are you serious?
Yeah, serious. See, basically,
And that will tell us whether I'm
see,
Kapha.
most of the time, you can check through your nadi also. That has to be on an empty stomach on early in the morning, before the onset of hunger, everything. See, you can check yourself. You actually know what your prakriti is. See, if, it's available on the internet, the list of Vata symptoms according to the Prakriti, Vata, Pitta, and Kapha. I'll give you a simple example. Like constipation is a sign of Vata increase. The Vata Prakriti, it's part and parcel of their life. If constipation doesn't bother a Vata Prakriti, they'll say, I've been constipated for 2-3 days, but it's okay, doctor. Right? You don't have to mention, you don't have to give any prescription for that. I'm comfortable with that. 2-3 days of constipation. But if you say a pitta person, he will keep coming to your clinic every day till the constipation is relieved. He said, it's bothering me, doctor. I cannot even work. I cannot think anything. I cannot, do any work. It's just bothering. The constipation bothers. Something which bothers is not your prakriti. The imbalance you are comfortable with is your prakriti. You are short-tempered, you shout, you are happy with shouting, that's your prakriti. It's a pitta prakriti. Okay. You are happy sitting in the same seat. If most of the kapha prakriti will be happily sitting even after the session is over also. But vata prakriti, before we end the session, they'll be up. And the pitta prakriti will be thinking, what this guy is keep on talking nonsense, when will he stop all these things?
No laughs for this. I wonder why. What are you all thinking? Okay. Okay, good. I don't think we can technically answer this. Is dementia and Parkinson's interconnected? Do you want to give an Ayurvedic sort of angle to this?
See, I've seen in my practice both are happening together, but both are two different spectrums in Ayurveda. A person with the Kampavata need not get a dementia, but both are possible because both are Vata Rogam. If they come under that spectrum, then possibilities are there.
So usually that's not the case from what we have seen. Not everybody who has Parkinson's goes on to develop dementia. But there are some cognitive issues for sure, and there is age-related, and also depends on the type of Parkinson's that somebody has. Saraswati, one interesting question for you. Yoga being a spiritual practice, can we understand that the treatment that yoga gives for PD is a faith-based therapy?
So Yoga Sutra does not talk about any particular religion. But faith is important. That there is something which is beyond this physical body and what you can see and experience. What has created this body? What is that intelligence that governs all of nature? Is there a curiosity about it? Is there a certain kind of reverence about it? That I would call spirituality. So if I have faith in something which is beyond me, that I know is far more intelligent, and I can anchor myself to that, and that will guide me, that will give me the direction for my life, that I would call spirituality, and that is what yoga looks at. So I don't think it is referring to any particular faith. It is for everyone. It is universal. Yeah. But depending on the faith of the individual, we can tailor the practice. So somebody comes who, let's say, a staunch Hindu, we may give them some chanting, some practices, some connection to a particular deity. If somebody comes who's a Christian or a Muslim, then we actually help them to connect with their faith and deepen it. And use the connection to God, to a higher entity for healing. Yeah, because even Yoga Sutra says your connection to Ishvara, what is that you're connecting to, that can actually help you to calm your mind and progress in your path of spirituality. So that is what we have learned from our teacher Desikachar, and that's what we teach.
Thank you, Saraswati. I don't know why I feel the need to explain after both of you have spoken. So it's not only faith-based, right? Anything like yoga, you need faith even in allopathy medicine. You need to have faith that Sindopa will work for you, or the doctor, that neurologist you're seeing is actually a good neurologist who is going to take you to the path of healing. Having said that, yoga is also extremely scientific. The way the body and the breath and the mind works, it's extremely scientific. But you need to have faith on what you're doing. So that's what Saraswati beautifully elaborated. With this, I think we'll close the Q&A. Thank you so much, Hina. We have few mementos to give. We'll call Malati Madam Malavarengla. Come to sir.
Thank you. Please have a seat. Please have a seat. Thank you to our audience for the great questions and to our lecturers for their enlightening perspectives on the questions. It's now time to honor our esteemed speakers with mementos. I invite Ms. Malati Narasimhan ma'am to present the memento to Dr. Sudhir Ayyappan. Ma'am, kudunga. Let's express our gratitude. Thank you, ma'am. I invite Dr. Radhakrishnan sir to honor Saraswati Vasudevan ma'am. Let's express our gratitude with a warm round of applause. Thank you, sir. Thank you, ma'am. Moving forward, I now invite Dana to conclude the annual lecture by extending our heartfelt gratitude to both the front and back-end team whose efforts made this event a success.
I am honored to deliver the vote of thanks on behalf of Parivarthan for Parkinson's Foundation. I want to express our sincere gratitude to the speakers, Dr. Sudhir Ayyappan and Ms. Saraswati Vasudevan, for sharing their insights and expertise with us today. Your presentations were enlightening and thought-provoking. To our attendees, thank you for taking the time to be here with us today. Your presence and participations have made this event truly special. We hope that you have found the discussions and interactions as enriching and rewarding as we have. To our sponsors, Metronics and all other sponsors, thank you for generous support. Your contributions have made this event possible, and we are grateful for that. I would also like to thank our media partner, The Hindu. Thank you for your extensive coverage and support in promoting our event. Your efforts have helped us reach a wider audience and amplify our message. To our venue partner, Savera Hotel, thank you for providing us with an exceptional space and outstanding services. Your team's professionalism and assistance ensured a seamless and enjoyable experience for our attendees. We appreciate your collaboration and look forward to future opportunities to work together. Before we conclude, I would like to extend our heartful gratitude to our valued physiotherapist, yoga therapist from Yoga Vagini, speech therapist from SRM, dance movement therapist Ms. Hina, counselor Ms. Vijayalakshmi, and all the friend of Parivarthan. And special thanks to our social media manager Srida, our photographer Mr. Gopi, and the team of audio and visual team. Once again, thank you all for being a part of this wonderful occasion. Have a great evening. Thank you. And
kindly proceed to the dining area for refreshments. Thank you so much.